recommendations for a fractured fibula by the ankle and avulsed talus?
So, okay, so again, we do the black cumin and the galbanum internally. With that, is there, there's probably a cast on that, I would imagine, or at least a soft cast or some sort of wrapping. So you can't put anything directly on that area. But usually what I have people do with that one is, again, you take the black cumin and the galbanum internally, but separately, and then put like kind of substantial amounts of marjoram up on the leg or up on the thigh of the same leg. And what that does is it decreases the spasms in the area, and it increases circulation and blood flow to the area. It helps the bone to heal and reduces some of the spasm. Because I don't know what happened, but that sounds like an injury where you probably rolled your ankle or like jammed your ankle. And so you're dealing with the injury of the bone itself, and then you're also dealing with basically probably a pretty severe sprain or strain. And so the marjoram will help. If you want, you can rotate using marjoram on the thigh with helichrysum. Again, that helps to reduce some inflammation, stimulates lymphatic movement, keeps you comfortable. The helichrysum will reduce spasms as well, but primary would be the marjoram. Yeah. Once the wrappings are off, cover that area with marjoram for a little bit and up the shin, because you're still going to have the effects of the sprain or the strain. You're having to splint it up and immobilize it because of the injury and the broken bone. But once that's done, you still have the effects of the sprain or the strain, and the rotation of both the marjoram and the helichrysum on the shin, from the ankle all the way up to right below the knee, will be very helpful. Like, front all the way around to the side, Yeah.
Thanks, Greg.
Yeah. Who is that, by the way? Yeah.
This is my friend Craigie. She is visually impaired, and she stepped in a hole and.
Yeah. Okay. Yeah. I mean, so if it was stepping in the hole, the other thing that we want to be aware of is every once in a while there's a little bit of a strain in the knee, and then the same side, the SI joint, the low back, where that little joint where your hip is, like where your hip and tailbone kind of meet. When you step in a hole, sometimes it wrenches the side of the pelvic girdle a little bit. So she could do still that, the marjoram and the helichrysum up on that area as well. But, like say this is my calf, right? Like say this is my calf, like this. And so like on the back side, so here's the Achilles tendon, like right above that, like up in here, where the calf is starting to turn into the Achilles tendon. So when you step in a hole, the muscle, if I remember right, this is going back, I want to say it's the soleus. It's called the soleus. Sometimes that will be the source of the strain, and that spot will throw off the SI joint up at the hip and actually have a referred pain pattern that starts to cause low back pain. So I would treat it as if when the splint comes off or the wrappings and everything, and she's able to let it out and just breathe and not have to wear that anymore, start treating that area on the back part of the lower leg with marjoram, or even like one of the peppers, like black pepper or pink pepper or pepper supreme, something like that, viscosity. Rub it on that area like every day for like maybe a week or two, just to unwind that lower part of the calf so that it allows for the ankle to function properly and not have a muscle imbalance, and doesn't throw off the SI joint up, in the hip girdle.
And is that all neat or in a little bit of lotion or?
If her skin can handle it, you can do it neat. But if the skin is real sensitive or real thin, then put it in a little massage oil or lotion or something, and then just apply it that way.
Thank you.
Yeah, you're so welcome. And keep me posted on that. Like I'm glad to talk you through it when the cast or the splint or whatever it is comes off.
That's great. Thanks so much.
Very common injury, by the way. Very, very common injury.
For